So I'm going to, this talk today is mostly clinical, but there'll be some sections, some theory in here as well. Just for some of you who aren't familiar with syntonics and just some of the basic ideas of syntonics, there's some of that in there as well. So I'm going to give you an overview of some of the technologies and approaches, techniques that are being used to treat learning problems, and specifically in our office, reading problems, reading and attention problems. And that'll go from present day all the way back, well, actually back to the 20s to present day. So some of the topics we're going to cover are Irlen lenses. Many of you have probably heard of these, overlays and tints. Syntonic phototherapy, some theory and treatment, information about Magno-Parvo processing systems, which are one of the newest models of major problems with reading in terms of processing information, color, some little bit on color puncture, neuro-entrainment, light, sound, and motion, and environmental concerns, and John Ott, Harry Wolforth, Rudolph Steiner. So one of the things that's been in the news for many years now is the use of Irlen lenses, and these are certain tints that students wear to help their reading performance, and it's based on a diagnosis of something that Helen Irlen called scotopic sensitivity syndrome. That's a syndrome that she defined as too much light coming into the person, and in fact there's kind of a noise factor, and the light that they look at overwhelms their visual system, and they have to start screening information out, and in doing so they lose their ability to read coherently. And she likens it to there's a specific allergy to certain light frequencies, that certain wavelengths we're just not receptive to, as Jacob talked about. But in the case of these children, their sensitivity prevents them from processing the visual word. The word will bounce around on the page, they can't concentrate, there's a lot of motion and movement to the print. She developed a system of prescribing about 140 tints to eliminate these unwanted wavelengths. So she views it as screening out the wavelengths that create the noise in the visual and auditory processing systems. And the tints may be prescribed by something called colorimetry. And there's a fella in England who developed, I can't think of his name at the moment, that developed a whole system of colorimetry to prescribe tints. In the classroom, teachers often use overlays. They'll have a couple hundred acetate sheets with tints on them, and they'll put them on the written page and see if the student's performance, if the student's performance will be enhanced by using these overlays. So it's very practical, done in the classroom, and it helps a lot of children. From the standpoint of optometrists, we view a lot of these symptoms and signs and problems these kids have as vision problems. Their eyes can't coordinate, they can't move easily, the page jumps around because their eyes can't stay focused or coordinated on what they're looking at. So there's the perception that using these kinds of overlays and tints mask underlying vision problems, and that's controversial within the profession of optometry, to the extent that many people disregard her work, but her work is certainly based on a lot of clinical experience and a lot of efficacy. I mean, it works, but they don't really understand how it works. So one of the ways it's postulated or theorized that this system works is by describing what happens in what's called the Magno-Parvo cellular processing. Now, what that means is that, that in your visual field around you, you have a central field that has a whole pathway through your brain, through the nervous system, that processes only what in a small area in the center part of where you're looking, the figure. And then there's a whole magno-processing system that processes your peripheral vision. And this peripheral vision serves to very quickly process the vision of the past and the future. That is, like say you're reading along, the magno system, the peripheral system, anticipates where you're going to go, leads your central vision to that place, and then extinguishes or erases what was right behind it. And if this Magno system isn't processing well because it's either has defects in it, which I'll show you, or whether it has a timing problem, it can't time itself with the central vision, then you have problems processing, moving your eyes along, keeping your eyes in place, but you also have comprehension problems because of what was just seen isn't extinguished quick enough. It gets mixed up with what you're looking at. And so you can have reversals, you can have loss of place, but you can have things moving around, but you have loss of reading performance. So it's theorized that Irlen Lenses in some way help synchronize the timing between these two systems. Now she didn't come up with that, but other researchers have. One in particular named is Harold Solan. But this whole system is very important. Now, these large, fast processing cells, again, are the leading edge of what's going to come to where you're going to put your attention and where you've just seen. Now, the other thing is that the Magno and the Parvo systems, in terms of their whole processing of the visual system, have right with them, coincident with them, auditory processing. So if you have a problem in the visual processing problem set, one of these systems, you'll also have problems in the auditory processing part. And unfortunately, much of what special ed teachers teach and reading teachers teach is based on the idea that reading and learning is mostly a language-based processing, and they ignore the visual system completely. And you can't do that. I mean, it's ridiculous, actually. It's absurd. But the medical people, let's say the medical people in the United States actually say that they've come out with statements, which they did even this year, that vision has nothing to do with learning and reading. Nothing to do with it. They view vision as nothing more than looking at a letter on the wall or the optical system itself. They don't look at the processing systems and they ignore it, but they go to the extent of actually denying the existence of vision's involvement in learning and reading. And of course, as eye doctors, we think that's, those of us who practice this approach think it's like the most dominant system of all. So, what Solan found in his research was that people who had reading deficits had defects in this peripheral system, and it affected their visual attention and reading comprehension. They did many tests and quantified these defects, and it said that it loses the motor control and the timing. And so what they found is that when they used blue tints, they were able to synchronize the timing between the systems in the most profound way. However, I'm going to show you later that you can use all the colors, because what it is, it's a peripheral vision problem, and there's many colors you can use to reestablish this Magno system and coordinate it. So what Irlen is saying is that you're overwhelmed and you have to screen out things. What Solan is actually saying, you're not assimilating things, so that you can't take in certain frequencies. So it's more of a syntonic approach. We give frequencies to establish a sensitivity to the system, not diminish its sensitivity because it's overwhelmed. So it's two different models talking about the same thing. Just briefly, Don's going to go into this in more detail, but as a behavioral optometrist, one of the premises is that vision is learned. It's a developed process. You can train all the skills of vision, eye movement, the ability to take your eyes and converge them and diverge them. That tells you where things are in space. You can train the ability to focus, which has to do with the lens in your eye, and muscles push on the lens and adjust the light to focus at different distances. That tells you what it is. Coordination tells you where it is. Peripheral vision tells you where it is in space relative to you. So all these different processing skills of vision can all be trained, they can be improved, and they develop throughout our whole life. And we train people that are 100 years old to get better vision in these processing problems. So one way of looking at learning and vision defects in terms of reading is these linear skills. The linear skills are, can I make my eyes converge? Can I localize it? Can I bring the information in a way that's going to allow it to be processed without a lot of difficulty? And then in the more global way is that there's these processing centers that are not just linear, but that are integrated with all kinds of things in our body, in our minds, in our whole makeup. And we'll give examples of those. So color has local effects, it has non-local effects. If we can give a red light, we can make your eyes turn outward. We can use a blue light and make your eyes turn inward. We can give different colors to balance your physiology. And all of your nervous system has to be in place to support your vision. Your vision has tremendous autonomic nervous system input. And so you have to be physiologically balanced to utilize your visual system in an efficient way. The idea of kindling, that there are positive and negative stimuli, and you can set off a cascade of events that bring your system out of balance in a sequential way from one small insult that can carry through your whole system. That your somatic body typing, your body is involved in all your vision and all your information processing. There are mirror neurons. You can look at something and your nervous system will immediately make neural connections to mimic what you're looking at. Which gets to the whole point is the whole system is plastic. The whole system is pliable. That all sensory, motor, emotional, reasoning, motivational neurons have total plasticity. And not only do they have plasticity, but they're constantly evolving and they're changing all the time. So you're not set with one basic neurological set. Your system is always evolving. And so this plasticity is especially sensitive to light and color. In photobiology, just briefly, when they put color and light on direct chromophores, things that are absorbed in your body, like in the eye, the skin, the neurons, the blood, the stem cells, the muscles, all have color receptive chromophores that absorb light. But these events, of course, drive local biochemical reactions, which the photobiologists are now documenting, but it cascades through our whole system. Energy models, we've been hearing at length about that. Alexander talked at length about all these things. The light travels throughout the whole living matrix. We have a crystalline geometry of the liquids and minerals in our body that act as waveguides of light that send energy and information to different fields that govern all kinds of biological activity. Trauma will embed dysfunctional patterns into the body, into the nervous system. And that's what we see with kids. They have trauma, most of them of some sort. And that trauma can be just falling and hitting their head. It can be having a series of ear infections, high fevers, things like that. And emotional stress, upset in the family, divorce, separation, all kinds of things cause imbalances in the autonomic nervous system and set up dysfunctional patterns throughout the system. So Spittler said that his main contribution, I think he took a lot from Loeb, who took from Dinshaw, and I think Dinshaw took from Babbitt, and Babbitt went to India, as far as I know, and studied at length, studied Ayurvedic medicine from way back. So they all took from each other, but Spittler said, well, the main way that light affects us in terms of our vision and the support of vision, of course, is through the eyes, and that he was the first one that talked a lot about that's the visible application of light that had the most power of all, he felt. And he wrote the Syntonic principle in 1941. You saw a picture of him Brian showed you this morning. So he said energy, the balances, Syntonic means to bring into balance the autonomic nervous system and the endocrine system. And these two systems, the hormones and the involuntary sympathetic and parasympathetic nervous system, support our vision and are absolutely essential for vision and information processing. It depends not only on our eyes, but it depends on the type of body type we have. Our constitution determines a lot how we take light in. That's a whole other field, a whole other idea. And that he said in his book, which I think everything in there he said in 1941 is completely true, that it affects the eyes, the way they respond, it affects cell growth, tissue growth, as Alexander was showing us this morning. Physical development, mass body potentials, the electrical potentials that drive all the biochemistry of our body can be influenced by light, by building up charge and dissipating charge. Develops our body type. It affects the action currents leaving the brain, such as EEG patterns. You can put in a colored light and out will come, you can affect all the EEG patterns. And we'll talk about some of the therapies that are used with EEGs that work with learning problems. Reproductive cycles, this whole idea that we have the retinal hypothalamic pathway, these connections go to our reproductive organs, to our pituitary, our pineal, all these neurological connections he delineated back in 1940, which are now basically accepted, and that certain colors balance the autonomics, and the hormones that come from the antagonistic glands with the pituitary. So it affects our health, it affects nerve receptivity, tension, it affects even the way we see at night. Vitamin A content is affected by certain frequencies of light. Pain reception, the strength of smooth and striped muscles, the balance of our autonomic nervous system, which we need to be balanced and regulated to live healthy. So light enters through the eye, through the pupil, that constantly changes, letting different amounts of light in and different amounts of light out. And so when we can watch with a light that Jacob talked about, a retinoscope, we can reflect light in and out of your eye and see how you take light in. And we can see it bouncing out. You can tell a lot about that person's conscious state, their health, their attention, everything just by the color and the movement of the light bouncing out of the eye. The pupil is constantly changing to bring more in and let more out. And it's tied a lot to our nervous system, our autonomic nervous system. And imbalances in our system are often seen in the way our eyes respond to light. So when if you shine a light into a child's eye and their pupil shuts down, and immediately opens up again and won't keep the light from coming in, it just can't hold the constriction, it means they have a lot of exhaustion in their system. They have adrenal fatigue. They're very depleted in a certain way. And you can see that instantly in 1 second, just shining a light towards their eye, or 3 or 4 seconds. So it's a very important diagnostic tool. And the light focuses in the macula, that's the center of the eye. That's a picture of the optic nerve in the retina. The optic nerve transmits or transduces all the electromagnetic energy and sends it to the brain and to different parts of the brain through electrical impulses, biochemical changes. The other thing is that when we shine light in the eye, where it's the only place in the body you can directly visualize the vascular system, so you can see all the veins and arteries in the eye, and there's a huge, like 25% of the blood flow of our body goes through our eye every 20 minutes. So when you give a 20-minute treatment, you're irradiating about a quarter of the blood supply of your body with that color. And so that's another way that light is transmitted by the blood. And of course, it goes throughout the entire system very quickly. Light is not just energy, it's also information. And a very good book about this is Science in the Akashic Field. Many of you may know this book, but it's a great book that talks about information as the fifth, basically as the fifth force. There's gravity, electromagnetics, strong and weak atomic forces, and the Akashic force, the information field. And so Laszlo talks about this, that every time we're delivering light, we're also delivering information, and that information is inherent within the photon itself. So there's a deep communication system between all light and in our consciousness, and you can go into a whole biophysical realm of that, which we won't do. Just as an aside, I said that the blood is being irradiated at this huge amount by all the light coming in. The blood is a carrier of this energy and information. There's a picture of blood. There's a picture of blood on the top that's been disrupted by physical and emotional stress, and then as the stress is removed, the blood reorganizes itself. So every time we're putting light into our body, not only are we irradiating the blood, but our body's about 80% water, and water is probably the most potent of all in terms of storage of information and organization. And so there's a picture of blood that's very coherent. It has a very geometric kind of shape and a geometric coherence to it. And there's a picture of blood that's totally disrupted. And in this case, it was disrupted by putting a cell phone up near the ear for just 10 minutes. There's a picture of water on the left that's closed in a bottle, and then on the right, when the sunlight is shined on it, immediately organizes the water. So the water is probably a huge storage capacity in terms of, well, Alexander was talking this morning, it stores all this thermal heat. It's one of the major, it probably stores all kinds of levels of energy and information. And it was very interesting to hear about what he talked about yesterday about the Greeks said that one of the major ways they use color was to change the fluids in the body. Very profound. Light also affects all the enzymes. All our enzymes have photoreceptivity. Energy is stored within enzymes in helix-shaped chains. A single molecule will break down 5 million molecules in a minute. To do that, it actually creates a three-dimensional structure for the reactions to take place. And this structural aspect of the blood and the water, this geometry, is also critical to the energy and information transfer. So there's a whole kind of sacred geometry that's tied to this whole water-blood system. And many of you have seen that pictures of this. If Emoto's picture, if you think of something terrible, like a murderer, the water in your body immediately develops a certain kind of crystalline structure, and there's a photograph of it. And if you have a thought of something pure and a higher form of consciousness, the water organizes itself into a geometry such as that. If you listen to heavy metal music, it may look like that, the water, and then it crystallizes if you're listening to Bach. So there's this whole system. I mean, this is all part of what learning is too, that our systems are taking in this information and how are they storing it and how is it going to be used in terms of all kinds of processing of information. I'm just going to quickly, I'm just trying to give you some of these other ideas, and I'll go on to the more specific therapeutic techniques. Another thing that happens in the blood is the hemoglobin releases something called nitric oxide. Nitric oxide is a carrier of information. There are sites that go into the hypothalamus of the brain and to different sites in the brain that actually signal different reactions in our body. Not only is it nitric oxide, but I learned a couple weeks ago there are also a reactive oxygen species, that is free radicals that are generated by irradiation, also are carriers that signal all kinds of things in our body that regulate our body. So we need a certain level of nitric oxide, we need a certain level of free radicals in order to regulate and signal things that are going on. And in this case, this signal to the hypothalamus also goes to, it helps release different hormones. If we don't have enough of it, we can have all kinds of degenerative diseases like hypertension, arterial sclerosis, tumor growth. Too much, we have, we can't constrict our blood vessels. We have things like glaucoma. We have neurodegenerative diseases that are associated with nitric oxide. And nitric oxide, again, is in the hemoglobin. It serves as a light-sensitive store. In the red blood cells, it's released upon irradiation by light. So this is just another pathway I'm talking about, just another of the many, many different levels and layers that light is being processed and used, from the cell to the chemical system to the neurological system, through all kinds of energetic systems. There's a picture of the pineal gland. And there's a picture of the pituitary gland. They're both going into the midbrain. And as Alexander said, the red is associated with the, or the blue is associated with the pineal, and the red with the pituitary, and they're constantly having to regulate each other. And so the pineal is now seen as one of the master glands of the body. And you know, years ago it was considered a vestigial organ and wasn't even important. So light has these direct connections, neural pathways defined and described going right to both of these glands. And it affects, in terms of the vision, these kind of connections through the hypothalamic, retinal, nerve pathways affects the sensory motor systems of our visual and body. That is how we take sense information in, how we use our muscles. It affects the endocrine system, the hypothalamus and pineal, affecting health, affecting the electrical charges in our body. It can be used, light can be used to adjust the physiology to treat diseases, vision problems, and emotional disorders. One more piece of anatomy in this picture is the thalamus, which is in the midbrain. All the pathways, all the nerves of your sensory system going into your brain go through the midbrain, through the thalamus, and all the motor efferent output goes through the midbrain. And it's through this system that it's a gating system that can either reduce sensory input by certain kinds of electrical stimulation with light, or it can depress it, and it can do the same with the motor system. So you can use a color to relax your muscles, to stimulate your muscles, to reduce sensory input if you're getting pain and you're overwhelmed, or bring you more sensory input if you're dull and you're lacking sensitivity. And so Spittler said the main way this happens is through the thalamus, and that's especially, the thalamus has an electromagnetic pulse, and it has points where it's very receptive to color, and it can totally change its electrical output by certain colors, and affecting all these other systems. So Spittler also talked about that the light affects the EEG patterns, and by doing that you can increase a person's hearing. And a whole other field has grown up called neuro-entrainment, which I'm sure many of you know of or heard of, that involves using light, color, and sound to treat attention deficit disorder, attention hyperactivity disorder. And one of the best sources from this is a man named Dave Sievers. He's in, I think he's in Edmonton, Edmonton, and he's Mind Alive, www.mindalive.com. And so he has an instrument where you put on earphones, you put on iPhones, and you entrain your brain waves according to the pulse of either the light and the sound together. And you can put your brain into various different kinds of states that you're not able to access ordinarily, or that you can't access at all. And by immediately putting your brain into those states, you become you're not learning to do it, but your brain learns how to have an access to these kinds of different states that you were basically shut out of before. So one example is he might use where he'll put 13.5 cycles per second into the left side of your brain, the more linear, more logical attention part of your brain, and stimulate it. And then he may put in 18 cycles per second pulsing on the other hemisphere of your brain in order to relax you or to stimulate that. So that you can try to balance the hemispheres of the brain by using certain kinds of light and sound input. And this has been especially effective with attention problems. And that's one of the areas he's got lots of studies to show that. And so here's another example where they may calm the right brain by using the left hemisphere 9 cycles per second and the right hemisphere 18 cycles per second. Or they may mix them up, the beta, theta. So you might have fast brain waves, which are going to the right hemisphere, and then reduce the analytical left part of your brain by going to the 6 cycles per second. So he keeps mixing, he has all these different programs. It doesn't matter, I'm just trying to give you the idea of it, that you can use these things to try to change the brainwave patterns to bring a coherence and balance to the EEG patterns that are so much out of disorder with so many kids and people who have reading problems, and especially attention-directed problems. And he even has programs for, of course, relaxation and even cognitive development. He'll take you through a whole cycle like we would do with color, maybe give you lots of different rainbow of colors. He'll take you from 8.5 cycles per second to 18 cycles per second and take you through all the different frequencies so your brain has learned to be more receptive to all the different frequencies, because for various reasons, traumas, again, injuries, your brain doesn't have the flexibility to make the change, especially in head injuries, this happens. But also a lot with kids. And kids have so many head injuries that are undetected and unrecognized. So just going back again, the autonomic nervous system, we try to stimulate that. Alexander went through this today, but in terms of vision, we use it to try to relax your focusing. If a person is over-focused and all, and looks up things up close, becomes very stressful. Their eyes turn in, they focus it near. We may give a sympathetic stimulant, a red end, or a yellow-green end, actually, to make them relax. And that can, again, in a linear way, help them process visual information. And we'll see when kids have reading problems that they lose all these kinds of visual motor skills. They can't turn their eyes in and out. Their eyes may go way out like this. They can't converge. So they always want to look out in space, and they're spacing out. Other ones, their eyes turn in. They get all into this space. They're totally introverted. They're all stressed and tight, and they have a whole pattern that goes along with that. So we may use light to pull them out again. And it isn't a cure. It's just part of the process of trying to anatomically drive them in a certain direction so they can rebalance and re-regulate themselves. Parasympathetic acts primarily, sympathetic acts through this hormone system, the thyroids, the adrenal medulla, pituitary, gonads and muscles. And through the nervous system, again, there's this whole matrix that sends information not only just to one part, but throughout our whole body simultaneously. And there's a liquid crystal matrix in the nervous system that not only drives light energy, it drives basic currents that go through us all the time, electrical currents. And it acts at the speed of light. And that's just a picture of a sympathetic hormone. You can see it has color, it has crystalline structure, has information, has energy. Parasympathetic, we can use blue colors to make a person's eyes converge, so we can try to get their eyes to come in visually in this way, to focus better, to come in if they're kind of in a pattern where they're just out there in space and they're disorganized. And that's very frequently the case after a head injury or anything inflammatory in the system. It causes a sympathetic overload and the eyes become conditioned to this pattern where they can't bring information in. So optometry spends a lot of time looking at these patterns and then trying to train them through exercises. And obviously, it's kind of it's just a piecemeal, broken down, and basically inadequate in a way, but a way of trying to reorganize a person. And we're going to see these patterns visually in almost any kid with reading and learning problems. We have one of these patterns or not, or another. And the parasympathetic is acting through the parathyroids and the adrenal cortex. So it has its whole system, the digestive system, the liver. It's more the visceral system. It's more our energy conservation system. So when we have an acute problem, say you've just been injured, you need to use blue-green, as Alexander was talking about. The acute things, we use the blue end of the spectrum to try to work on the visceral system, bring energy back in within people and restore it. So with kids with reading problems and learning problems, again, we're always looking to see, does it seem acute, does it seem chronic, and what kind of vision pattern do they evidence? And that leads us to the colors that we're going to use, at least to start with. And that's parasympathetic hormones, and again, full of color, full of geometry. And then the autonomic nervous system, we won't go into it really, but it has, not only does it have a balance where if you do the sympathetic, the parasympathetic parts are balanced, but they also can be co-activated, co-inhibited. So if you're under a lot of stress, you can have everything hyped up, and a person who has an injury will be very angry and very hyped up, and others will have everything depressed, and their system is depressed. Endocrinology, nervous system, emotionally, physically. And then we might even have unilateral approaches. So it's not a simple one-to-one thing, but when we use color, we know we're affecting the balance of the autonomic nervous system, and we can do it. We have to look at the whole case and the whole situation. But this man, Alan Shore, said that all of our emotions are tied into this system, and that the autonomic nervous systems and its neurohormones wire and mediate our behavior. and that the frontal part of our brain is the command center for this kind of regulation. And when there's injury, the most common place to be injured is in the front, in your forehead. When you fall and hit that, and that causes damage in the frontal area. And that results in poor regulation of the autonomic nervous system and affects peripheral vision and brain electrical coherence. It has a whole cascading amount of events that affect human emotion and performance. And that it's mediated by hormones, that memory is tied to it, motor stress in the brainstem it affects our memory of what we see and what we remember. It can start affecting the balance of the way we take light in. And it affects, in this whole cycle between the front of our head to the limbus and back to the cortical area of our brain has to be flow to create memory. So if a kid has no visual memory and no visualization skills, there can also be problems in these particular defects in this kind of flow. So that was just a rapid kind of exposure to some of these ideas about syntonics and the kinds of things that we look at. I'll go back into it a little bit more, but well, actually, we'll just move ahead here. Yeah, we saw some of the instruments today. In fact, Brian showed a number of the instruments that are used in optometry. One that wasn't mentioned is an instrument by Mary Bowles, who in 1995 developed an instrument, a table where you would lay on the table and you would look up and there would be a photon wave machine that all the colors would go through, and the table would rotate in this fashion. And then you would wear earphones and you would be given auditory integration tapes to try to reestablish the auditory part of your visual processing, the visual and the vestibular all simultaneously. And she worked with the kids who have really major problems, such as cerebral palsy, all kinds of retardation, developmental problems that are very severe, and has had wonderful results in using this kind of multi-sensory approach. Briefly, there's been numbers of studies to show the effect of color and light in terms of reading. And in '83, Kaplan did one showing that form fields responded to color in kids who had learning disabilities. Jacob did a great study, the effect of syntonic colored light. I won't go through the details of all these, but effect on light and cognitive functions. An optometrist named John Searfoss showed that many school-age children have restrictions in their peripheral vision. And a lot of this is detailed in Brian Brilling's book, Light Years Ahead. So Kaplan showed it. I won't go through these again, but Jacobs, one of the things that he found in his study, that kids treated with colored light had a 4 times increase in visual span, that is how much they could look at and take in. They had over 200% increase in their visual fields. Their visual memory was improved 7 times. And their auditory memory was also improved 1.5 times, and 75% had improved schoolwork as a result of syntonic light treatment. Another study by a doctor named Steve Ingersoll used syntonics along with other kinds of training at these special schools he has in Michigan called the Livingston Developmental Academy, and he's published his works a number of times now. But he found that reading speeds would improve tremendously when syntonics and color was used to open up their peripheral fields. And if you added other kinds of learning along with it, visual, perceptual learning as well, the best outcomes of all. But another study that showed how the effect of color in terms of reading. And Searfoss, I just mentioned, he found that 20% of all children in grades 3 to 10 have field constrictions, and that our attention is directly is related to these field constrictions. That when we use our visual attention, we capture, we inhibit, or we focus light, and we can change that ability by using light training, light therapy, color therapy, to improve our ability to change all these different dimensions that are used and so important in reading. And he found that there was a hierarchy of our visual fields in terms of this Magno-Parvo system. And when we have constrictions in our visual fields, we have a loss of visual and attention flexibility. So without attention, there can be no perception. I'm not going to go through. These are all different other models. We saw this picture. There's one a little in color. How the tying in of all the energy around us, within us. In the Syntonics, what we do is we look at, we try to train these different splinter skills, focusing, attention, coordination. And the history that's so important in this, where we find the kids have these kinds of restrictions in their ability to take in light, has to do with head injuries, fevers, ear infections, toxicity, and stress. And I was reading just yesterday, they're now saying that kids become obese is because they're exposed to toxins in prenatally. And that it's a whole other thing we're finding, that their nervous system, their hormone system in particular, and their regulatory system is disturbed by toxins that allow basically an uncontrollable production of fat cells in their body, because there's a whole regulatory system that's been broken down by the pesticides. So toxicity is probably going to be the #1 health concern in our country. I talked about the pupil earlier. We can monitor the status of how we're processing light through the pupil. If a person can't move their eyes fully, if you ask them to track something and they can't track it, they probably don't have good peripheral vision. That's one of the things we're looking for, because the peripheral vision is guiding the movement of your eye. It's that fast system. That if we measure the ability of the eyes in terms of their energy and stamina to turn in, maintain their attention, turn out, look far away, look close, those abilities are all constricted as a result of those kinds of things like head injuries, fevers, ear infections. And of course, the biggest thing is the visual fields are constricted. And the way we measure visual fields is we have you look at an object and we bring it in from the side until you can see it. And we bring it in and we plot it on paper. And that's a very dramatic way to represent how you process things that are in your periphery. And it's very accurate. We also process your ability to see color in the fields. So we measure your ability to see red, green, blue. And each one of these colors, if you don't have the normal sensitivity of these colors, they have a reflection of everything from green means there's an infection. It may be grief, it may be loneliness. Red may mean you have a systemic organic problem, but it may also mean that you're overindulging yourself. You're abusing yourself in some way. Blue has to do with the heart and the adrenals. Thymus, energetic representation of feeling, emotion, spirit. So the fields constricted, you're going to hear a lot about fields from Denise, so I won't go into this too much. He's going to give it to you on a much more expansive level. So it was found that back in the 1924, that Brombeck said that kids had reduced fields, and they also had enlarged blind spots, I'll show you in a minute. When you measure the visual field, where your nerve is in your eye, there's no vision, and that's called a blind spot. And that's, again, where the nerve transmits energy to your brain. But the blind spot will enlarge to reduce information coming in. And it can enlarge, and it can change shape and size very readily. But it's a reflection of how the nervous system is taking in information. But he found that a huge amount of these kids had enlarged blind spots. And that the idea also is toxicity first depresses the color fields, then the form fields, and the basic sensitivity. So there's kind of a process of that. And Alexander talked about all these things this morning. The red is, except we would break them down into red would be a sensory stimulant, orange a motor stimulant, green is the balancer of our physiology, and then as we go into the emotional side, blue is a more sensory depressant, indigo a motor depressant, and violet a more intense sensory depressant for pain. Okay, and I'm not going to go through these. You've heard these. So in Syntonics, we treat you for 20 minutes. You come in 3-4 times a week. We have you exposed to the light, And we use these different filter combinations, never usually colors in isolation, but always in combination. So the difference between Syntonics and other forms of color therapy is we usually use red-orange, yellow-green, blue-green, blue and dark blue. We very seldom use one color in isolation. But you can, but we generally prescribe in that way. We do a series of treatments. The standard in Syntonics is to do 20 sessions and then do checkups every 6 to 8 visits and see if the person's changing. You'll see the fields are opening up, and I'll show you that. Okay, we talked about the instruments. Here's just a representation that if you're taking in everything in your environment, you're assimilating all the colors that are out there. But if you're not, there's a restriction in what you're assimilating. And one of the ways, the metaphor or the analogy we make of you not taking in all the light is by measuring the visual field. So we take the fields up close, but 8 inches away, looking through an instrument, one eye at a time, and it has about a 40-degree span of your ability to see at near. And we do one eye at a time, and that would be a normal field. But what happens is the field starts losing its sensitivity. And this really is, I think, Denise, do you have that picture of the photograph with you? I mean, where you show it just gets blurrier and blurrier. Yeah, you don't have that. Well, anyway, this makes it seem like the field is totally shiny, you don't see anything, but it's kind of, again, a metaphor. Your attentional field, your ability to process is getting smaller and smaller. It's not like you walk around and you really only see that, but you only process in a very small area. And so as we measure the field, it's a reflection of where you can detect what's going on around you. So it's called a functional field. It's not like you're blind out here, but I might be able to say, okay, there's 2 fingers here, and a kid won't be able to say, oh, 2 fingers, do you get it right in front of them? They can't process except over a very small area of space. And this is the biggest diagnostic and biggest therapy angle of Syntonics, is we look at these fields. No one else in our profession does. We look at them and we treat them with color, and then and on paper it may be that small. We may, instead of seeing it out here, we bring it all the way into there until you can see it. And then we give them the color, and well, I'll show you again. I have some better pictures, but we use basically a series of combination colors. The blue-green is for acute problems. The yellow-green is for chronic problems, toxins, glandular imbalances, try to balance the physiology. We use red and indigo together to try to affect the adrenals and the emotional body, the emotional system. And we use red-orange to really try to stimulate the system. And we do that when there's person's really shut down. Let's say their eyes really cross, they're really in, and we're trying to stimulate them to have more sensory reception. And there's a field that's starting to get bigger, and there's a field that looks fairly normal, and that's the blind spot. So there's a field where the field is down and the blind spot's very enlarged. So that's another way, the other part that I was just talking about, the blind spots. And there it is as it gets better. And also, I don't think it comes through, but there's a device called a frequency doubling field screener that flashes light in the periphery. And what it does is it measures frequency receptivity within the field itself. And that's where we measure these magnocellular defects. We can see, if you can't see these certain frequencies of flickering light, you can't process in certain parts of your field their reduced sensitivity. And that's a big part of this Magno-Parvo inability. So you can have a field that's pretty good but still have defects within it, and so we look for that as well, and then we treat it and they get better. Yeah, it's so faded you can't see it, but the field there had defects and now it's all cleared up, and that's getting much more normalized. There's another field, same thing. So those are the kinds of data that we collect. Now, I'll just talk about a couple of cases here. One is, this is a boy with reading and writing problems. He had double vision. He's got history of ear infections. We measured he can't focus as well, his eyes well. He was given, he was given ruby colored light for his emotions and yellow green light, 10 minutes of each. And I don't think you can even see his field. We also measured his eye movements with a special device called a visograph. You can measure, what you do is you have a child read something, and it has an infrared sensor, and it monitors all the eye movements that they make on a set page of about a 100-word document. And it's standardized against certain norms. And what this instrument does, it measures how many eye movements you make, how many times you have to go back and look at what you just read, how many times you lose your place, how many words you can see before you move your eyes. And you get a good idea in terms of ocular, motor, visual function in terms of how they're reading. And so I'll just move ahead here. Oops. Yeah. So anyway, that's the graph of that. And so the upshot is that after his fields opened up, he could move his eyes. They were smooth. He could focus again, improve reading, writing performance. In terms of looking at 100 words, he moved his eyes initially 313 times. After his field opened up, he only moved it 162 times. He initially had to go back and look at the word again 139 times. Only 38 times did he go back and have to look again. His span, that is the amount of words he could see, was 0.32 to 0.62. And his reading comprehension went from 69 words per minute to 160. So you do the test, and then you have them read, and then they take a test and see what they remember. So this is a very nice way to show some efficacy in terms of helping reading problems. And it's basically by using color and opening up, balancing their system. Okay, I don't know if it's worth doing more. Here's another one. I don't want to belabor it. And it's hard to see it even. Oops, I think I went too fast. I just wanted to talk about this for a minute because this is interesting. How am I doing? I think I'm doing pretty good. Right? I got about 10 minutes. Okay, I'm almost done. So, well, actually, I got a couple things. Okay, I want to show you this too. Oops, I'm sorry, I'm really going out of line here. Okay, just briefly, there was another thing that we use is something called heart rate variability. You can look at the coherence of the heartbeats by measuring the beat of the heart, and it tells you a lot about how the heart is functioning. The heart is, of course, our second brain, our intuitive brain. It's the part of us that we have to have the head and the heart working together. It's our intuitive side, and that the heart, the intelligence of the heart can be kind of an output of that can be the coherence of how well the heart beats, it has its beats, how close they are together. And so you can measure heart rate variability, and you can see, first of all, if a person is in the sympathetic or parasympathetic system, if they're out of balance in a certain way. And in this particular case, this was a kid that we treated. He had double vision and high anxiety, stomach disorders. His eyes didn't work. He had poor visograph. We gave him, he looked like he was so, I think she was a girl. She was so stressed that we started out with indigo and blue-green. We wanted to calm her, to sedate her. And she got worse. And so at that point, I did a heart rate variability and saw that, and then I changed the color. I gave her ruby and yellow-green. So I thought, well, go the other end. Maybe that'll, and she didn't get better at all. And then we measured the heart rate variability and found that she had imbalances on both parts of her autonomic nervous system. There was just a lack of coherence. Like both parts of her system were out of balance. Like I talked about, the autonomic can be mutually stimulated or mutually depressed. That's what she was like. There was no coherence. So we prescribed actually something called indigo and N. N is a neurasthenic treatment. That is, it works on nervous fatigue. It's a special filter in Syntonics. And after that, everything improved. And that was all based on the heart rate. And so there's this whole other field. I don't know, many of you are probably familiar with it, but it's a great tool. For us, because we're talking about the sympathetic, parasympathetic, you can get immediate readout if which part of the nervous system is dominant or imbalanced, and you can use that as part of a guidance to see what kind of restoration you're making to the whole heart system. And Sheldon Pierce, he's got a whole book written about it, where the heart processes information, communicates by intuition, pervades the whole body. The heart is giving input from exterior around us, from the universe, and this developing the intelligence of the heart is the next evolutionary step. So energy learning depends on the balance of our physiology. Attention is central to processing. We learn to organize information. Another system I'm going to go through real rapidly is using color puncture. Sarah Cobb developed a system called the Acolyte Vision System, and it basically tries to balance the body through the hemispheres and through different points on the body. And one of her inspirations there were two major inspirations, Nishant Matthews and Samit Sadi, and the work of Peter Mondel, and then also Dr. Pagnamenta, who is a pediatric physician, pediatric physician in Switzerland that treats all of the kids only with color. So his whole practice is based on that, and this came out really poorly. But you just put color on certain points of the body, on the eye. You put color across the forehead. This came out really poorly, but you run color over different points on the brain to synchronize the brain and different parts of the head. And they all have different points in order to try to balance the person and help their learning. So she's using this. These are the specific ones she uses for learning problems and reading problems. Okay, so we're nearing the end here. So another aspect of way color is being used in terms of learning problems is in the classroom. John Ott was the first one that talked about the need for, not probably the best known one to talk about the need for full spectrum in the classroom. They found when they put in full spectrum lighting that they did time-lapse photography of the classroom. Maybe many of you have seen those pictures. The hyperactivity level dropped tremendously. And that then when they measured academic performance, the same thing happened. Harry Wolfarth put full spectrum lighting into the classroom and then also set up certain kinds of paintings of certain colors, different warm shades, and found that when they did that and they did physiological measurements, and they did double-blind studies where they didn't do it in certain classrooms and others, they found that their blood pressure, the kids dropped 20 points. There were a third less absences, disciplinary incidences reduced, IQ tests and academic performance went up. So very important. And in terms of the classroom environment, and one of the most well-known and famous is Rudolph Steiner, who established the Waldorf schools. And in the Waldorf system of education, they pay attention to the color the rooms are painted at various forms of development. So they basically, they go through the, well, first of all, there's the idea that in education, we're also training ourselves to the supersensible world, to develop cognition from the spirit, not just from the physical. And that light, Steiner said, basically unifies the moral and the spiritual forces in terms of emotion. And when you give kids color, it basically is the impulse which leads them to action. So color is very important in leading them to action. I'm sure you're going to hear about this from our educators in much more detail. But anyway, they use it at kind of a rainbow effect. In the first grade, you start out with pink, and then you go to kindergarten and pink, and then you go to orange in the first grade, and then melon, and then yellow and green and indigo, all the way up through the grades. And not only is the room painted in a certain color, but there's a technique called Lazur technique, which is used to instill an etheric quality and results from light reflecting off penetrating multiple layers of the pigment. They put multiple layers in and rub it in, and it gives this reflective technique that is very penetrating. And that each color corresponds to a spiritual, psychophysical stage of development. Their development is tied to the different colors, and you can foster and encourage learning, environmental concerns by bringing this color into the classroom, and of course the lighting as well. All right, that was a whirlwind trip. Yes, Elizabeth?
Yes, Mary, could you tell something about
It's not only about kids. No, we see many adults. We have lots of adults in training. We have a lot of adults who can't read at all. They've been poor readers their whole life. The thing is, they were probably that way as children as well. And it's not too late. I mean, we've been able to help a lot of people start to, be able to read comfortably, and they avoid it because it's very stressful. Because usually they don't have so much poor peripheral vision, but they have poor vision coordination, focusing. They can't bring information in easily without all kinds of tension and aversion. We treat them the same way, yeah. And we treat from all ages. And we treat lots of rehabilitative things where people have had injuries, closed head injuries, strokes, auto accidents, and they regress back, and they have lots of defects in their visual processing that makes reading, they don't even do it. They can't even do it. And yes, they can be rehabilitated. And color's the main tool that we're using. Yes? Yes, the comment was that do kids get better quicker? Absolutely. Yeah, they're more acute in a way, but they're much more plasticity in their nervous system, and they respond much quicker. So yeah, the kids are your greatest cases. You can see major changes sometimes in as little as 2 or 3 weeks. The parent will come back and say they're reading now. They're picking up books. They never picked up a book in their whole life. So yeah, kids are definitely less layered. There's less layers of dysfunction. Yeah. Any other questions or comments? Okay. Thank you very much for your attention and everything.